Welcome to the instructional video for the WatchPAT home sleep apnea test. This video will cover the setup and use of the WatchPAT device and tips to help ensure a successful test. Please refer to the video titled Home Sleep Apnea Testing for important information on what to do before, during, and after your home sleep apnea test. It is important to note that certain medications and implanted medical devices can cause inaccurate measurements. Be sure to alert your sleep provider if you are taking medications such as those listed here. Also, please alert your provider if you have a permanent pacemaker. Before applying the testing device, be sure to remove any nail polish or acrylic nail from the test finger. Trim the nail if it is long to ensure that your finger fits snugly inside the finger probe. Avoid wearing jewelry or tight clothing to bed, and avoid using hand cream. Your test kit includes a watch-like recording device and a finger probe, which is likely already connected to the recording device. Your kit may also include a chest sensor. This sensor measures sounds such as snoring and body position. Please note that it is possible that the equipment you receive may differ slightly from what is shown in this video. Always refer to the instructions included in the testing kit. You are now ready to apply the testing equipment. If your test kit includes the optional chest sensor, apply this first. To apply the sensor, thread the cable through your sleeve to the neck opening. Peel the backing off the sensor and apply it to the skin over your breastbone. You will need a 4-inch piece of medical tape to secure the sensor to your chest. The tape is usually included in the kit. This sensor is applied to the skin over your breastbone, right below the notch between your collarbones. You may need to trim chest hair if you are having difficulty getting the sensor to stick. If the chest sensor wire is not already connected, plug it in to the bottom of the recording device. The next step is applying the watch-like recording device to your wrist. When securing the watch-like device to your wrist, make sure to apply it to your non-dominant hand. This allows your dominant hand to be free during the testing, limiting disruption of sensors and reducing the risk of the equipment getting wet in the event you would wake and need to use the restroom. Apply it snugly to your wrist as you would a watch, but not uncomfortably tight. The final step is attaching the finger probe. Correct positioning of the finger probe is extremely important to ensure a successful test. The probe is usually worn on the index or pointer finger. Alternatively, the ring finger may also be used. If you have larger fingers, however, the pinky finger is recommended. Once your finger is inside the probe as far as possible, press the tip of the finger probe to a hard surface to anchor it while removing the plastic tab that covers the sensor. Grasp the top tab and gradually pull until the tab is removed. Be careful not to twist the probe. There is a balloon inside the probe that inflates after the plastic tab has been pulled to keep the finger secure during the test. This may cause some mild, temporary soreness in your finger, which is normal. At this point, all sensors should be attached. You are now ready to begin your test. Turn on the device by pressing the circular button in the center of the watch. The device will do a short self-test. Then the message, "Good night," will appear on the screen. The test has now begun. Once the test has started, you cannot turn it off. You may now go to sleep. Remember, if you awaken during the night, do not turn off the device or remove any sensors. If any sensors become disconnected during the test, reattach them. Avoid getting the equipment wet, for example, if you wake during the night to use the restroom. When you are done sleeping, remove the testing equipment by removing the finger probe, the chest sensor if you applied one, and finally the watch-like device. Please note, you do not need to turn off the watch-like device. Do not throw anything away. The WatchPAT home sleep apnea test is now ready to be packed up and returned. Follow your facility's instructions on how to return the device. Good luck!